Before asking the opinion of the public payer who is present here with us, I would like to ask also pharma industry, how do you feel and how prepared are you in the perspective of, let's say, of HA evaluation, in which the subject of evaluation, it will be the drug plus the test which lead to an efficient use of the drug. Because going also backwards in the clinical research, all the companies, they developed the drugs according to some testings. So what is your feeling about, this type of unifying the drug together with the testing?
So first of all, let me give you my perspective of where we are right now. So I'm glad that we are in a debate facilitated by Aspen Institute. And I would like to make a parallel. I learned it from the Singularity University in California. Matching the IT progress versus genome sequencing and where we are now in the genome mapping versus, let's say, 5-6 years ago. In IT, and everybody is a specialist in IT, we know that tremendous progress in computing power has been made. And just a parallel, a smartphone, I will not mention any brand, has now more processing power than had the American Army in the first Gulf War. So thanks also to this progress in science, we were also able to make huge progress in genome sequencing. And years ago, it looked like it was a budget of $800,000 to map the human genome. And they thought it will take years to do that. Now we arrived to a cost of less than $100 for that, and the time is really very, very limited. So from this perspective, I think we are on an exponential curve in the field we are talking right now of personalized medicine. And that, I believe, requires also education. To be able to cope with these challenges, you need to be educated and to understand what is going on. So this is just a bracket. I think it's not a pure coincidence. We are in the National Institute for Statistics, but statistics say that 99% of HCV infected patients in Romania are of genotype 1b. And now I come to and answer straight to your question. It is, from this perspective, very important that we treat right the people that benefit from that treatment, and the payer has all the interest to look in that population and to ask evidence for that and reward if progress and success is associated to this targeted genotype. But I would like also to go beyond. I learned 8 times Senator Mircea Joană mentioning the word solution, and at that point I stopped because he continued to mention this word, and my colleagues in the first panel also mentioned very many times the word solution. So we have to move forward from the price perspective when we look at a product or a service to the cost perspective, and why not to the value and to the patient satisfaction in the end. So here as industry, we want to partner with anybody to get to the right model that in the end fulfills the expectations of the patients and proves a positive outcome for a healthcare priority that we have designated in our country last autumn.